Hello, this is Danny Blyth, a brief introduction to Guasha. So gua is a mouth and a knife, so to shave or to scrape, and sha are the resultant spots, so this is a sickbed, and san, so the sand-like painless spots that come after you've done Guasha. Remember, this is for acupuncture students only. Please pause and read this. So first of all, we get consent from the patient. We make sure our diagnosis is correct, and we check any contraindications, and then we apply a suitable oil for lubrication, and then we're doing some guasha. So we have our non-dominant hand for support, nice gentle pressure. Our dominant guashaing hand, we're using first of all some smearing before the tool hits, and then using the tool, so going from top to bottom, and 4 to 6 sun strokes. I'm working through a single area, repeating the same stroke over the same area until the sha appear, and then I'm going on to the next area. So the pressure should be enough to do the job but not painful, so get feedback and ongoing constant feedback from your patient to make sure that the pressure is okay. Remember, this is going to create a painless rash that's going to last for a few days up to a week or 10 days, so make sure that your patient knows about this. As I work across, I'm changing the angle of my stroke, but always I've got a 45-degree angle to the guasha tool, and I'm leading with a kind of blur of my fingers, and then the tool is hitting. I'm changing the pressure with the other part of my hand. So gradually working across, we tend to work inside to outside and top to bottom, and we work wherever the problem is, we work above it, through it and below it to make sure that we've got all of the area covered. When we're working up into the neck and against the occiput, we can't really work in downward strokes, so now I'm shifting to an upward stroke to work up the neck and into the occiput itself. So this is a young, fit and healthy patient, so I'm using relatively strong and quick strokes. You obviously moderate that for frailer patients. Best to only work on a relatively small area of the body in one go. This is moving to the chi and blood, so it is somewhat depleting. So work over an area of the body in a single treatment. So our method, we use oil as a lubricant. We aim for a 45-degree angle with our guasha tool. Less if you want a gentler treatment. Looking for 4 to 8 sun strokes, and these are repeated until the sha completely appear. The stroke should be firm but not painful. Get feedback from your patient, and generally speaking, we scrape top to bottom, inside to outside, and above, through and below any problem. Empty conditions slower and lighter. Full conditions, as I'll demonstrate here, stronger and quicker. You can follow different angles for different muscles, so you often follow the muscle fibers or the underlying anatomy. So I'm demonstrating using a disposable lid. For strokes towards the body, use your thumb to contact and blur the stroke. You want a 45-degree angle from the lid, and your fingers control the pressure. For strokes away from the body, use your fingers to blur the first contact. Again, you want a 45-degree angle, and the heel of your hand controls the pressure. So strokes towards the body and strokes away from the body. Contraindications include, if there are still scar from the last treatment, any recently traumatized areas, over large blood vessels, varicose veins, thrombosis, broken skin, swollen areas, if there's a high fever or convulsions, over any lumps or swellings, unless you know that they're non-cancerous, over the abdomen and back during pregnancy, over damaged skin or skin conditions, moles or pimples. We also don't do guasha on haemophiliacs, patients taking anticoagulants, and patients that are prone to bleeding. We also don't do guasha on anybody with a blood-borne virus. Caution or contraindication for the face and head, more than one area at a time, patients that are prone to bruising or taking steroids, weak, frail and elderly patients, and children without a very good explanation of what you're doing. Remember, this is going to create a rash which is going to last, so you need to inform your patient and make sure that they know how long the rash is going to stay around for. This gives you an idea. So this was the scar straight after treatment, this was the second day, this was the third day, and this was the fourth day, and they disappeared by the fifth day. Guasha tools should be single use and disposable, and they should be disposed of safely. For up-to-date safety information, see the British Acupuncture Council's Code of Safe Practice.